Good evening. My name is Sharon Closius. I'm the president and CEO of the Valley Community Foundation, and I want to welcome all of you tonight. This is a wonderful group of people, and I know it's a very important topic. And I want to thank you to the Community Center, Senior Center, for hosting us here tonight. It's a wonderful space that you have and being able to do this. You know, ever since we did our community index with all the Valley nonprofits, there was a 2005 community index done. And in the back, you're going to see something that looks like this on the table on that by the windows. This is shining a spotlight. This is like the summary of the community index. And you can follow the QR code. You can go on to many websites. Our website, Naugatuck Valley Health website, Team's website. Do you have the Valley Index? To get even more information. And one of the things that we found when the information that came out is that the Valley seniors is a very growing population. I'm sure that doesn't surprise any of you in this room. I think it's gone up 20% since just over time. It's been going up, and 20% of our population are Valley seniors. So it's a very important topic because what we find and have known for quite some time is that people want to stay where they are. They want to age in place. And so how do we age in place, especially when we have older buildings, stairs, narrow hallways, narrow bathrooms? What all has to get done and able to allow you to stay in place? The other thing that is difficult and a challenge all over, not only the Valley, but the state as well and the nation, is that we have a bottleneck in a sense of housing, right? Because many people are kind of stuck in their housing because they can't afford to move out of their housing. They want to get smaller housing, but they can't afford to move out. And then you can't have other people moving back in. So it's like, how do we do this? And you want to stay, if you can't stay in your house, you at least want to stay in your communities. So there's a lot of topics that go on. I was mentioning before that this evening could probably turn into 5 more different events to talk about these different issues. So I welcome you tonight, and I want to also introduce our great, I'll go this way. Our great panelists that we have tonight, these experts here. We have Jess Christie and Lisa Trupp, who are from our Naugatuck Valley Health District. David Morgan, our CEO and president of TEAM. And TEAM has so many programs that is just a full list of all the things that you guys do. And Mary McNellis, who is the director here at the Senior Center. So before I turn it over to Sandy Arbor, I'd like to introduce Kara Rochelle, who is one of our congresswomen.
Hi everybody, I'll keep this brief. We're really here to hear our panelists, but I'm State Rep Kara Rochelle. If you live in Ansonia, New Jersey, you're my boss. And so what I do is I help pass laws at the Capitol and bring resources back to the community. And you may not know this, but at the state capitol, we actually have an aging committee. So there is a committee specially designated to address the issues that matter most to our residents as they get older, the challenges they face. I did bring a couple things in the back in case you'd like to read. One, I have a senior resource packet that I brought in the back of the room if you want to grab one on the way out. It has a bunch of phone numbers for every type of resource you may need. And the other, in case you're a policy nerd like me, is the 2025 legislative update specifically on acts affecting seniors. So all the laws that were passed that may be beneficial to you or your friends or someone that you know or care about. So I'll leave it at that. I'm here to listen. I'm here to take it in and to be partner to these wonderful people who are on panel tonight. Thank you.
Thank you, Kara. Thank you for coming. Now I'm going to turn it over to Sandy Arbor. She is our manager of grants and nonprofit capacity. I always get your title wrong, I'm sorry.
Grants and Nonprofit Support Manager.
Support Manager, a whole long time. So anyway, thank you all for coming again, and here you go.
Thank you. Thank you, Sharon, and good afternoon, everybody. I want to say good evening because it's dark out, which we all, have to get used to, but good afternoon. So just a little bit of housekeeping before we start our presentation. You will find index cards on your table with pencils. So throughout the presentation, we're going to have our panelists do their presentation, but I want you to write down any questions you have. So while they're doing their presentation, I will collect all the questions, and at the end, we will go through all the questions, okay? So I would like to, like I said, welcome you. I am Sandy Arbor, the Grants and Nonprofit Support Manager for the Valley Community Foundation. I'm very happy to be here. This is something very near and dear to me. Some of you that know me, since the year 16 and my age, I was working with seniors. So I've dedicated my career to aging services, and this is very near and dear to my heart. So I'm just going to start with the first few slides. Okay, oh, there we go. Okay. So aging in place in the Valley, what does this look like? So as we all know, there are challenges, barriers, and opportunities. I'm just going to stand to the side here. Wherever there are challenges and barriers, we always have to make sure that we see the opportunities. So welcome again to our Valley Community Foundation Learning Session. Current challenges, now these are just some of them, like a summary. We have economic challenges, we have poor long-term financial planning, we have a lack of community connections, a lack of community outreach, and sometimes a lack of local family support. You know, we're of that generation where our families have moved away, and now we're on our own. So we have to figure out and pre-plan how we're going to live in our communities. Some additional barriers are a lack of safe and available modes of transportation, access to community resources, access to available and affordable health care, lack of community connections, and limited municipal resources for our aging populations and community outreach. So we're lacking all those things, and we could do a little bit better with them. So where there are challenges and barriers, there is opportunity. So that's why we have our distinguished panelists here to talk to us this evening. Sharon already introduced them, but I will go through them again. Mary McNellis, Director of Community Services for Seymour. David Morgan, CEO and President of Team Inc. And we have Jessica Christie, Director of Health, and Lisa Troop, Health Educator for the Naugatuck Health District. So I'm going to turn the mic over to Mary McNellis. She's going to start us off, and she's going to talk about how important senior centers are.
Hi, everybody. You all know who I am by now, Mary McNellis. I'm the Director of Community Services here at the Seymour Community Center. I oversee both the Senior Center and the Recreation Department. This is an exciting topic. I'm actually honored that they asked me to present on this, so I hope you guys learn a ton. What does aging in place really mean? I think when we all think about it, we think it means just staying in our home, right? That's what we think about, the walls surrounding us. Really what it is, though, it's about and I'm gonna probably interchange different, I'm gonna say seniors sometimes. Sometimes I'm going, this isn't working? No? Okay.
That goes to the camera. That's just the camera.
We're double light. Okay, I got it now. I may say active adults at times. I may call them seniors. I may call them older adults. So just keep that in mind. But really what all this means is it's more than just a house, right? It's just more than keeping them in one place. Our older adults need to have a purpose. They need to have connection. They need to have health supports, and transportation, as we all know, are just vital. So creating a purpose is the first thing I want to talk about. The community center in general, and community centers all over, senior centers, all of us really focus on healthy mind, healthy body, right? That's what we all want as we grow older. We want a welcoming place where we belong and where we thrive. And then we also want a community hub, and that's what our senior centers are. They're really a community hub where we can stay connected and we could learn and we can just be well off and doing well. Social connection and belonging. I'm going to tell you a brief tidbit about me. My father died when he was 93 years old. I remember I've been in this position for about 10 years. He was probably about 86 to 87. He looks at me and he says, or I look at him and I say, Dad, why don't you and Mom go to the Trumbull Senior Center? Great idea, right? I'm a senior center director, right? Perfect idea. He sees everything we're doing. He talks to me about it. He's very supportive. My father looks at me and says, why would I do that? He says, that's for old people. I just threw my arms up in the air and I said, okay. So when that happened, a light bulb kind of went on in my head and I said, okay, we need to change the narrative. We need to grab people younger. So we started promoting our center to 50 plus, and we started calling them active adults. So we needed to change the stigma of what a senior is. So when we introduce our programs, our services, our opportunities to people sooner on, they stay connected with us from the beginning, and then when they really need us down the road, we're here for them and they're comfortable coming to us. So it's been really crucial in the development of our center here, and we do this through a lot of different things, through our clubs, through our socials, through our luncheons, through our trips, through transportation, peer support, and volunteer opportunities. So I'll talk a little bit about health and wellness. You all know senior centers and community centers. We offer a ton of health and wellness programs. So sports and fitness, wellness workshops. So when we do this, when we talk about sports and fitness, wellness workshops, activities, we're looking at the whole person. Is what we're trying to look at. Everything from wellness workshops we'll do heart healthy lunches, we'll do dementia workshops, we'll do diabetes workshops, and then we have all kinds of clubs which you're all very familiar with. And this brings me back to the lifelong learning, right? I had a resident come in my office. She comes in probably twice a year. Her name is Virginia. And she walks in and she just says, Mary. And I know she talks to Morgan too. Everyone, that's Morgan in the back, by the way. She is huge in where this community center is going and where the senior center is going. She's our active adult coordinator. But Virginia came into our office and comes into our office quite frequently, and she says, I can't thank you enough. She says, we have a place where I can come where not only I can exercise, but I can go to lunch and learns. I can go on a trip. And if I need a service, you guys can help me with that service. We have to remember that many of our seniors, older adults, active adults, they were working, everyone was working, right? And now they come home and they're in their homes. And what are they doing? Their children have moved on. Even if their kids are in the area, most likely they're working, right? They need that sense of purpose. They need that sense of something else. And she said, you give that to us. She goes, I love learning. She says, I love exercising, but I love learning. So by bringing them all these different types of guest speakers and classes and volunteering roles and tech education and arts and crafts workshops, I think we're filling a void that we can't underestimate. We're getting them out of their homes and they're coming to us. They're building a family and a bond. So we all know about transportation and accessibility, right, and how important it is. This is a challenge, I think, for most community centers and most senior centers, a challenge for us as well. But it is essential for our older adults. They may be at home, they may be living it independently, they are aging in place. But at one point or another, they may not be able to drive. So we have to be able to offer those services, and those transportation services, yes, they are to our community center, but they are also to those doctor's appointments, they're to those errands that they have to run and they have to do. So it's really crucial. These transportation services, another way that they age in place and that they remain independent. It gives them a sense of purpose that they can do something on their own. They can call someone, but they're able to go to that doctor's appointment, or they're able to go to the luncheon that the community center had. Social services, and I know Team is going to talk a great deal about this, but our municipal agents, also crucial for senior centers, for community centers. we've now hopefully grabbed a lot of our active adults early, right, our older adults early. So maybe they joined when they were 55, 60, 65. Now they're 75, 80, 85. They're independent, they're aging in place, but they need some other support systems now. And those support systems could be in any form. They could be with us helping them for an application for renter's rebate, for energy assistance, for fuel assistance, for Social Security, for SNAP. So we're another resource for that as well that I don't think we can underestimate. And then there's partnerships and community collaboration. Senior centers, community centers cannot do what they do without the help of our partners. And this could be foundations, this could be our schools, this could be our commissions, this could be our nonprofits that help us, whether it be by funding or whether it be by offering a program to us, or whether it be by volunteering. On the topic of commissions, I'm going to tell you a little bit about a program that we kicked off here. And I have, in the middle of the room or so, we have Livable Communities, and we have the Commission on Aging from the Seymour Senior Center. And Suzanne, way in the back of the room, Suzanne Riley is in the back of the room. Suzanne, do you want to talk, or would you like me to? Suzanne's going to talk to you about a little program that what we did was we collaborated, my department and Suzanne, and we collaborated on a program that I think has been extremely beneficial.
Thank you very much. Yes, our community members from the Livable Communities Committee and Commission on Aging are here today. And we'd just like to share what we have done is, our purpose is to try to make people in the residents of Seymour feel at home and feel like there are people who care about them. So we took on an initiative a year ago to make phone calls to anyone that had not rejoined the community center that had been members in the past. And there's a list currently that we're using that are 75 years of age and older. And we take time to give them a call and see how they're doing and see if they need any programs or services in the community and how we can connect them to some of those services. In addition, if we don't reach them, many of them don't have voicemail set up, so we actually write them a personalized note. And they get that in the mail, and that kind of just shows again that we're interested, and we send them either the flyer or other things. We're preparing right now to actually do a mailing to all of those individuals on the list to actually ensure that, one, they know that people care about them and are open, and many times it's just wonderful to hear what they're experiencing. There was an elderly couple in their 90s, and they both got on the phone when we called. They were making chocolate chip cookies for an upcoming holiday. It was just great to hear the joy in their voice that, one, we called, and two, that they had that experience together. But many are lonely and as they're aging in place, and knowing that people in the community where they live are interested in how they're doing and showing that we care really makes a difference. So I thank our committee members for participating and for being able to provide this service. In collaboration with the community center, they've been extremely helpful.
Wonderful. Thank you, Suzanne. Another role that I think a community center plays, as Suzanne was talking about this, I have a staff of 4 full-time people. We get to know our members. We get to know our active adults who are aging in place. And what happens often is Morgan will come to me, or Tara or John, and they'll say, you know what? Victoria hasn't been here in 3 or 4 or 5 weeks. And we kind of go back and we look and we say, why hasn't Victoria been to us? You know, she seemed fine. We don't think there was anything wrong. And Morgan and I, or Morgan or I, or whoever will get on that phone and we make a call to say, hey, Victoria, we miss you. Where are you? And we hope that they pick up. Sometimes they pick up, sometimes they don't. And if they don't pick up, we make sure everything's okay. So it's a well call. We make sure everything's okay. If they don't pick up, we typically go to our emergency contacts, and then we call a son or a daughter or whoever they have. I cannot tell you, and it brings joy to us immensely, the gratitude from these families and these people when we call them, because they feel a part of our community. They know they have a purpose. They know that they're important to us. So these little things that we could do, in addition to all the fun things, right? The exercise programs, the trips, the lunches. In addition to all of these things, there's these little things that we could do as a community to help people age in place. Okay, so you know I had to have a slide on challenges, right? Because everybody has to have a slide on challenges. Funding. Everyone has funding challenges. We couldn't do what we do without the collaboration we have from different foundations, from different donations and so forth, but funding is always a challenge. We try to keep our pricing very reasonable and a lot of free classes, a lot of free offerings. So funding is absolutely a challenge. Limited program spaces. As we grow and grow and grow, you run out of programming space. We had 115 people in this room earlier today for our Thanksgiving luncheon. We had to close it off. Amazing, great project. That's the kind of problems the director always wants to have, right? Until you have to start turning away people, right? So a challenge. Transportation gaps, which we've already talked about. They can't get to us if we can't reach them, right? We have to be able to reach them to bring them to us. And then lastly, just diversity of the population. Our population diversity, it's changing, which is wonderful. It leads us to an opportunity because we have our members meeting new people, and there's language barriers. We have to all adapt to things like that. So those are kind of our challenges, but we always look at them as opportunities as well. And then just in summary, I mean, aging in place, it's absolutely a community effort. Couldn't do it without these guys. None of us can do it without each other. Aging in place is just not staying at home. It's about being a part of your community and having a purpose. That's really all I have. I hope that was informative to you guys. If you guys have anything else, please let me know. All right, thank you.
Thank you very much, Mary. And speaking of resources and services, I'm going to turn the mic over to David Morgan from Team Inc., who is going to explain a lot of the services that connect with the senior centers that are offered throughout the valley. David.
Check, check, check. The moment I wake up. No, all right. So appreciate your grace and your patience. A lot of talking heads talking at you. My goal is I'm going to give you a very quick buffet of Team Inc., a couple of windows into the work of Team Inc. But on behalf of Team Inc., our goal is to continue a connection afterwards. Got amazing team leaders that I would follow anywhere to my right here, in the front here. But if you want to dive deeper, so I really want to protect your time, and I hope there's maybe some Q&A or time afterwards to, I couldn't say it better than Mary. I mean, we are social beings. The brain is a social organ. Our hearts are social organs. And when you think about what the science and the research has taught us, isolation and social isolation across all age bands, especially older adults trying to enjoy their third trimester of life here, social isolation, the research is very clear. It can be even more devastating than other chronic health conditions, such as even smoking. Now, I'm not suggesting you go light it up if you're a social butterfly, but you get the idea, and that's really important. And I'll end on, this isn't my slide, but it's an amazing looking slide. Aging in place, a community effort. Oh. I was in downtown Seymour, they just grabbed me and said, hey, we need somebody to, thank you. Okay, so, all right, so again, it could go on all night. Team Inc., our community footprint, our core services, including older adults in all walks of life, is 10 towns and cities, including what we call the core beloved valley, including right here, this beloved Seymour. Just in the last year alone in Seymour, we've served close to 3,000 residents of Seymour alone. Total number of residents from the greater valley region, including Milford, our footprint is in Milford as well, is close to 19,000 residents in the last year alone. I'm going to skip all this stuff. I'm sure these slides will be available as well from the Valley Community Foundation. I'm just going to highlight some stuff around older adults and elderly services and home heating assistance. But as you can see here, again, from prenatal and parents and families trying to do the best for themselves and their loved ones and call Seymour a home, call this valley a home, and all the way throughout adults, young adults, working families, older adults. Some would say cradle to grave. That sounds kind of depressing to me. So it's just, you know, what a win to have this fleeting time on earth. So all kinds of basic needs, gainful employment and training programs, housing assistance. Sharon spoke about housing. I'm just going to focus on elderly services, specifically in home heating assistance. And some of the numbers, again, we just highlighted some of the specific programs, but a little over 5,000 homes last year that we assisted with home heating assistance, provide some supplementary relief to address the high cost of heating our homes throughout the winter. And it doesn't matter what your fuel source is, whether it's kerosene, propane, oils, a very common one, electric, utilities, even wood, if you're burning wood. But a little over 5,000 homes we assist. And we also have very modest ability to help with heating systems. So furnaces, boilers, water heaters. We can all agree that you know, if you can increase the efficiency of your home, that can retain your limited dollars to stay where we need it the most in our pockets. And so we have a number of stories where we can do clean test tuning of heating systems, boilers, and actually do repairs and even full replacements. I don't want to give you a big false, we don't have an open checkbook. It's a great integral partnership with the Connecticut General Assembly. Representative Rochelle is a great leader in leveraging some of these resources to our valley, and many of all the other legislators as well. But we do have a limited pot of money where we're able to help with those heating systems, but it's very limited. Our community meals program, I'll touch on that again a little later. Over 11,000 meals to over 300 older adults at Callahan House in Seymour, many other locations. We actually, I'll get into Griffin in about 2 minutes and 20 seconds. Incontinence Supplies, you know, the Area Agency on Aging is another integral partner. They're based in New Haven. Great Nancy Valentine here, board chair of Valley Community Foundation, turning red, former mayor of Ansonia. I could go on and on, but one of the things we recognize, you know, we were talking about Area Agency on Aging, but one of the top needs was, you know, again, you have limited resources, and older adults who call the Area Agency on Aging, which serves the city of New Haven, but also their footprint includes the valley. And for us at Team Inc. and the Health Department and the Seymour Community Center and the town of Seymour, like, the valley will never be overlooked. We don't allow that to happen. And so there's a lot of older adults who live and love right here in the valley, and they're calling New Haven, I need help with this, I need help with this. Incontinence supplies was a big one. So we've really doubled down on our ability to deliver and work with caregivers to deliver incontinence products, close to 34,000 to 145 older adults. We've even gotten creative with our Meals on Wheels delivery routes where we can actually deliver the incontinence supplies, you know, not creating more things to do as a frail homebound older adult and or a caregiver managing their lives and trying to help their loved ones. So we do medical transportation rides. We did over 7,000 rides helping older adults get to medical appointments and other critical care appointments to over 200 older adults. Elderly care, that's case management, so navigating public assistance, navigating what you may be eligible for, the good, the bad, and the ugly of do I have a safe, decent place to live? Can I afford to live there? Accessing home heating assistance, just essential service navigation and trying to unpack the deep complexities. I'm very blessed and privileged to have worked in the nonprofit sector and social services, human services, and I'm still trying to navigate that stuff. It's very complicated. And so we have dedicated staff at Team who can help older adults navigate some of those things and bring them to those who need it the most. 75 that we do critical case management on. Homemaking and volunteer services, close to 3,000 hours, a little over 137 older adults right here in the Valley. Think of examples of like light housekeeping, chores, picking up prescriptions, telephone reassurance. You know, Suzanne Riley said so beautifully what Mary was saying, you know, just checking in and saying hello, how you doing? How's life going? How, you know, you matter, we matter, I have value. Light outdoor work and so forth. And then we also, I think I saw Gene Sosnovich back there from the Valley Indy, Shine the Light, wrote, no bias here, but wrote an incredible article on Team Project MANA, which stands for Mobilizing Action for the Nutritional Needs of All, and Team Self-Interest in that is we make a lot of referrals to food pantries. Seymour Oxford Food Bank, Little Free Pantry on Skokerat, Neighbor to Neighbor Pantry in Oxford, Christ Episcopal Kathleen Samela Food Pantry in Ansonia, Greater Valley Salvation Army Pantry in Ansonia, St. Vincent de Paul in Derby. And so, you know, it's kind of convenient for us to not become a food pantry and just say, yeah, go there, go there, go there. So we put skin in the game, and we work really hard to raise money and then and get food, healthy foods, diet, you know, high proteins, dairies, the stuff that we tend to we see in limited supply. Fruits, vegetables, and so we work with this network of food pantries to help stock those shelves. And right here in this beloved valley, my goal here is not to shame or blame or make anybody feel guilty. My goal is to say, hey, what better place than the valley where we can band together and address some of these current conditions in a land of such abundance. For shame, anybody should be struggling with the food on the table. And right here in this valley, we see a little over 2,300 individuals from all walks of life walking into those food pantries every month. And about 17% of them are older adults trying to enjoy that third trimester of life, as I said. Close to almost 500 older adults walking into those food pantries. So Team Inc., strategically as a board and staff, we're deeply committed to addressing food insecurity, and this is one of the things we do, Team Project MANA. And we in 172,000 pounds of healthy food. Pounds is kind of the universal metric, if you're wondering what that is, just divide it by 1.2, and that's how many meals it is when you look at it pound for pound at a national larger metric. So close to 144,000 pounds of food. Whole bunch of other stuff around young children and families, housing, family child care providers, other social support services, but I'm going to protect your time and just skip along there. I'm going to dive into one of the programs that I kind of glossed over on the buffet, is the, no pun intended there, but the Meals on Wheels program. These are our 4 key goals: eating a meal that meets the nutritional needs, and we have individualized dietary menu options based on those dietary needs of older adults, providing that daily social contact that Mary was talking about. I've had the privilege to get in these trucks and knock on the door and be with the Team Meals on Wheels driver, and don't want you to leave, you know, like, I don't think I'm overstating it, where in many ways Team Inc. is the highlight of their day. You know, they may have walked their loving partner home, you know, they passed maybe 3 years ago, they may be alone, they may be disabled. I'll share with you a little data of the numbers, but I'm just going to go back to what I said earlier, that social connection is the most powerful investment in building strong communities, to Mary's point. And then care coordination with healthcare providers. We get a lot of referrals from doctors and physicians around, you know, we really want to avoid institutionalization. We want to avoid hospitalization. We have our legislators and policymakers. You can look at a lot of studies. Brown University did a study where you could look at, you know, when you think about, you know, the public trust and using limited public dollars and taxpayer dollars and fundraising dollars, the cost of a Meals on Wheels program for an entire year equals the cost of 1 day of hospitalization or 1 week of a nursing home. So when you think about the incredible return on investment in our local communities around a program like Meals on Wheels, it has such a profound return from a dollar and from a public policy. And you know, our dear Kara, Representative Rochelle, totally gets that and advocates for this program very well. So that's care coordination, and there's multiple examples where individuals have had strokes, broke their hip, you know, at 1:30 in the morning, and they didn't have the lifeline, they didn't have the thing to pay for. That's not irrational, they just didn't have it, but they knew Team was coming in about 4.5 hours from now. They knew Team was coming, and so I'm not overstating that it is a lifeline. What Meals on top of the social connection, on top of, you know, assured access to nutritional foods, and even in the individual. I'm in the beautiful town of Seymour. It's a number of years ago. I remember this happening, and the Meals on Wheels driver, nobody's answering the door, goes through the contingency protocol. I'm going to skip a lot of steps to protect your time. The individual had a stroke, but was able to do the emergency protocol, come into the house, call 911, and I'm going to skip more stuff. Older adult is getting brought to the emergency room, and 48-year-old daughter is already there waiting for mom, who's coming in, and mom's life was saved. And what that means for, I have an older adult mom, and what that means for me to know that others are always checking in. I remember being in Ansonia one time, and it was just happenstance, but I'm with the driver, and the gentleman's in there going through the mail, and we were delivering the meal to his mom, and I just asked him how we were doing, how's team doing, and he says, I'm telling you, if I could be here every day, I would. I've got 3 kids, I'm married, I got the full-time job, I'm here today going through some of the mail. I don't have and then he just starts crying. I mean, he just starts with gratitude for what Meals on Wheels and that social connection that you heard, when you think about the whole family. And then I will wrap up. Here's the numbers behind Meals on Wheels. Just in the last year alone, over 400 older adults in this beautiful valley. When I say in programs and the bureaucracies, it gets very complicated. So I'm just going to, our Meals on Wheels program, Team Inc., is 5 towns. Ansonia, Derby, Oxford, Seymour, Shelton, period. And that just has to do with lots of histories and bureaucracies. There's other providers. But Team Inc. does a nice job saying, well, we don't do that directly in Bethany or Woodbridge, but we know who does, and we can send a referral. So if you ever have friends, families, neighbors that may not be here in Seymour in the Valley, Team is really good at making linkages. We're really good at knowing what we do and going in on it, and we really work on community partnerships so we can give a quality referral. Again, over 400 adults, over 104,000 meals in the 5 Valley Community Foundation towns. 67% are either, more bureaucratic terms, federal poverty levels and stuff, but 2 out of every 3 are really struggling with limited fixed income. You heard Mary speak to that, living off of a fixed Social Security, still having to pay those, maybe the house is paid for, but damn it, I still got to pay for those, oh, I'm sorry I said that, but still got to pay for those taxes and so forth. So very limited income. 72% live in isolation. Close to 1 in 5 are severely disabled. 5% Alzheimer's and other related neurological disorders. And 64%, when I was talking about risk of institutionalization and hospitalization, and they're not because of Meals on Wheels, and that goes back to that return of investment. And to, I believe it was Sharon Closius, I mean, this isn't, it's not rocket science here, hearing, more than 90% of older adults saying, I want to age in the place I raised myself or my family or my loving husband, my loving wife, my loving partner. I want to stay in place. And so the idea that we're able to do that, and 1 in 5 are 90 years of age or older, about 19%. Away from Meals on Wheels, if you're less, I know, right? This really is the last one. What about mobile? More ambulatory, I can get out of the home, I'm not frail, I'm not homebound. What I was talking about the community meals, like Callahan House. We've got a video. Come on up here. We got a great video here. And what'd you say?
The Hellraisers at Griffith.
Will the Hellraisers stand up? Are they in the room? Okay. I'm a slow one, but now I caught it. There's some real troublemakers on the picture here. Thank God it wasn't me. Okay, but there's a video. It's on our website. It just got released in January. This is the best kept secret in the state of Connecticut. It is I keep trying to inspire, and some days when I'm feeling kind of, I want to shame other healthcare institutions to do this. Inspire, shame, you decide what you want to, But it is the only example in this entire state of Connecticut where we have a partnership of a hospital, Griffin Hospital, and a community-based human services organization like Team Inc. working together and actually providing a community meal service at the cafeteria of Griffin Hospital. If you've been there, I don't need to tell you more. If you haven't been there, I'm telling you, people will think I'm nuts, or like, in a hospital? I'm telling you, it is one of the best. I mean, so immaculate. I see heads nodding, so immaculate, and the array of choices and options, and the commitment to dietary health needs is really awesome. But we just released a video, and there's 3 testimonials in there, and it talks a little bit about the social isolation, what Mary's touching on. But Joe is in that video, another fellow Valley resident, and he talks about, I want to thank you for the relationships that I made with other people just by showing up at something like this. And then he gets into, and Mary really touched on it beautifully, like, thank you, team, for giving me an opportunity to help someone else. Like, you talk about a higher purpose, being part of something meaningful, that sense of belonging Mary was talking about, being part of something bigger yourself. You know, we sometimes, intentionally or unintentionally, the community kind of writes us off the list as we age. And what's beautiful is Joe talks about meeting people, and somebody who really, they desperately needed an air conditioner, and Joe's like, I got an air conditioner, I can come help. And he helped his fellow neighbor. And that's, I think, what the Valley Community Foundation is all about, is like, how are we creating those connections and building a sense of community? And when you look at that report from the Valley Community Index, you know, we are the 7th oldest state in the entire country. You can look at the data in the Valley. We are outpacing the state of Connecticut with aging. Now, I'm going to say with Loving Agitation 2 things, and close with this. Yes, we need to be responsive to the unique needs of the aging process as human beings, and what that means around housing access, what that means around mobility and transportation and sidewalks or the lack of sidewalks, public transportation. Yes. And healthcare and aging in place. That's a really, really strong, poignant thing to focus on. But I just want to say with Loving Agitation, also, don't look at this so much as a deficit, people. Also look at what an incredible strength we have here in the Valley, the wisdom of the greatest generation. I make mistakes every day, every week. I'm constantly learning and recalibrating. My ability to ask other individuals who have been walking around the mountain a few more times than I has made all the difference when it comes to addressing very complex community conditions, like I heard housing affordability, or you know, an ecosystem of assured access of food, education outcomes, employment, economic development, living wage employment and access. What better pot of wisdom to draw from than our older adults who have so much experience and wisdom? So to me, yeah, that's a huge strength that no one else has, and we need to seize that. So thank you.
Thank you.
Thank you, David. I will switch the slides here. And I think we keep hearing the same thing, how important connections are. Connections to the resources, connections to get you out of isolation. You know, I'm going to turn it over to Jess Christie, and I'll give a final few thoughts after that.
All right. Can you hear me? We're working? Okay. I'm going to take this. Thank you. Let's do a pulse check. We're feeling good? Yeah? I couldn't see the pictures of what everybody was laughing at, so I'm going to have to go back and check that out. I want to be mindful of time. You know, this is a lot of information that we're talking about tonight, a lot of great programs, and a lot of hope and motivation for things that we can continue to build on and do together. I also know we have Jeopardy, Wheel of Fortune, and Yukon Men playing tonight, so we want to make sure we get to that Q&A. As mentioned, I'm the Director of Health here for the Naugatuck Valley Health District. We are a public health service agency that serves the community of Seymour, but we also serve Ansonia, Derby, Shelton, Beacon Falls, and Naugatuck. So we have 6 communities that we provide services to, and we do a lot of community health-based servicing. Some of you may have attended some of our programs that Lisa's going to talk about in a little bit. We also do regulation and environmental health services. When it comes to individuals who are renting and dealing with landlord or housing issues, when it comes to the places that you eat at and restaurants, septic systems, well water, all of those things the health department takes under our umbrella. But really tonight we're going to focus on some of the data that was released in the latest 2025 Community Health Needs Assessment, which is that Valley Index report that Sharon mentioned earlier tonight. And I do really want you to take one of those spotlight summaries so that you can flip through it and look at the larger document if you have time. So we're going to talk some data and then bring it back to the programs to round us out. A lot of words on this slide, don't worry. The thing that I want you to pay attention to is the symbol of the tree. So when we think about public health, individual health, community health, we think about not just the actual physical health, but all of the things around us. And we call those social drivers of health or social determinants of health. And so with this kind of analogy here, we have the trunk of our tree, which represent our policies and our programs. So that's where we collaborate on initiatives to make things available, to make things affordable. We look at things like the physical environment, how healthy is our environment, everything from walkability, transportation, clean air, clean drinking water, health behaviors, things like substance misuse, food and exercise, relationships, staying connected in your community. We talk about social and economic factors, our ability to afford to stay in place, our family support, our income. We're going to look at some of those things. And then the clinical care as well. So all of those things, if those are successful in what we're doing, we have this lush, green, beautiful tree that branches out. And we have these kind of under the soil systems that we're trying to keep watered so that they're not coming up through the roots. And those are things like infrastructure, resources, institutions, and systems. So I just want you to kind of think about that, that it's not necessarily just health care. When we talk about public health and individual well-being, we're thinking about all of these puzzle pieces that come together. So you heard at the beginning of the presentation tonight that about 20% of the population in the Valley is our older adult population. When we look at the 6 towns that the Naugatuck Valley Health District serves, with the additional community of Oxford, which is another collaborative town that we work with on a lot of these health assessment initiatives, we can look at by town. Beacon Falls, 25% are age 65 or older. Oxford, 23.1%. Derby, 20%. Shelton, 20%. Ansonia, 18. Seymour, 16. Naugatuck, 14. But all of those communities are trending up year after year. So we are seeing that shift and that increase time and time. When we look at those communities, we also see that there's a disparity among life expectancy. And this might be a little bit small to see, and we'll make sure we share this out for anybody that's interested. But we see that there's a 5.7, almost 6-year difference between our 7 towns when we look at life expectancy. And contributing factors, David, like the programs and services we have, the affordability of the community, the ability to keep connected, to have healthy food options, to have exercise programs, all of those things that make up that tree play a role into the life expectancy. And so we can increase that by improving community health and reduce that gap and raise those numbers up. When we look at financial status of individuals aged 65 and older in this report, we looked at some survey data. So we actually participated in a statewide initiative called the Wellbeing Survey, and that's a survey that's done by an agency called Data Haven. We also did a local survey here in the Valley through the Valley Council for Health and Human Services because we really wanted to hear what people were saying and not just numbers on a page. We wanted to hear the stories behind it. So when we were looking at financial statuses, we saw that for the most part, people are living comfortably, about 75%, but I'm 68 and I'm still working to be able to afford to live here. Or, I need affordable places to be able to feel connected. So when you think about places like a community center or even the health department services, we really have to get creative sometimes with how we get funding to be able to bring those costs down so that we can make sure that they're accessible for everybody. So again, this here talks about senior services, and it's just more data to support what Mary and David were already talking about earlier. One of the community members said that they need assistance to be able to stay in their home and have home care that's affordable. Being able to provide home care health would avoid costly inpatient rehab and improve the quality of life for elderly in their community. When we think about keeping people out of the hospital, when we think about putting someone into a care situation, sometimes people want to stay at home, and that's okay, but they may need help, and that can get quite expensive too. And those are not things that people necessarily think about sometimes until they're having to deal with it. So thinking about that early on and doing that early planning for the what-if scenarios is really important. When we talked about kind of the sentiment, we wanted to get the pulse on what people were thinking about in terms of ranking issues that were important to them. We heard from our senior population that food and food accessibility was a top topic of area of concern. Senior housing, mental health, elder abuse, we'll look at that in a minute, and then community connections. So again, nothing new that we haven't heard earlier this evening. David talked a lot about his Project Manna and our food pantries, and wow, we have a really strong network here in the Valley, and it's so inspirational and encouraging, and especially in light of everything that's been going on at the federal government level, and making sure that people have access to not just a meal, but a healthy meal is inspirational, motivational, but also really sad sometimes when you think about how many people don't have access to food, which you think should be a basic necessity, right? That you have access to. So we saw among our age populations an increase across the board for people utilizing the pantries. When we looked at the total number of people using the pantries in the age 60 and older age group, it was about 32% of people. That's a lot of people going to pantries, right? We heard about Meals on Wheels data, so I'm not going to repeat that. Again, Agency on Aging, state programs to be able to work with agencies like TEAM to deliver senior nutrition programs, hugely, hugely important. And it's important that not only are we aware of it and accessing it, but that we're continuing to advocate for the funding of it and the expansion of it. According to data, we saw that there were reported elder abuse situations in the Valley, and these really relate to exploitation, neglect, emotional and physical abuse, and then some abandonment issues as well. It's not representative of everybody. This is a slice of the pie, but it's an important topic. It's a horrific topic to have to talk about. But the point is that there is services available if anybody should feel that they're experiencing any one of these, or if you feel a family member or someone that you know is experiencing this. Anybody can report elder abuse. It doesn't have to be a mandated reporter. There's different mechanisms. You can call, you can go online, you can complete a referral form, but resources and support are out there for the good, the bad, and the really bad. We're going to talk about some services that Naugatuck Valley Health District provides to the whole community, but also some of the programs that really kind of focus on this population. About a month ago, I think almost to the day, we held a flu vaccine clinic, I think in this room. We vaccinated close to 60 individuals. We do clinics all over the valley. We provide a number of adult vaccines, but our seasonal influenza clinics are probably our biggest initiative during the months of September, October, and November. If individuals can't come to a community center or a senior center or our office, our nurse will go out and do homebound vaccine appointments. So we can actually go into the home and meet you where you are. If there's additional services that are needed, we work with other social service providers to make sure that we either have a team member come and meet us, or we can make that referral and help that person out. We talked about staying connected and having that sense of community connection. There's volunteer opportunities here, there's programs, but there's also some programs that I want to talk about that maybe are non-traditional or you might not have heard about that are available and always seeking additional volunteers. The Community Health Improvement Plan, CHIP, a nice easy word to remember, especially if you like to snack on them like I do. That is a project that is starting right now, and it's a product of all of the data that we heard in that community health needs assessment. We have narrowed down priority areas that we're working on related to mental and behavioral health, food and nutrition, improving access to care and other social needs, and chronic disease. The work that we're doing in those 4 topic areas is done by members of our organizations and agencies, our municipal partners, other social service providers, businesses, but also community members and people experiencing or just having a general interest in any of those topics. So if you want more information or are interested, we would love to talk to you about joining in one of our CHIP groups. The Medical Reserve Corps is a national program with a tricky name. You don't need any medical credentials or experience. It's really mostly non-medical volunteers, but it focuses on giving people training and knowledge and experience in the areas of emergency preparedness and response. So it's a flexible training program for all different levels of skill sets and mobility. And the goal is, if we were to experience another disastrous event, maybe it's an extended power outage with a shelter operation, maybe it's a pandemic, hopefully not, we want to have the community be prepared. And we're always recruiting and looking for individuals. So especially if you have some free time or maybe are looking for ways to get active, engaged, to continue to learn and do skill set building, that might be a good opportunity as well. The CERT program, Seymour has a community emergency response team, very similar to the Medical Reserve Corps, focused on building skill sets in the area of emergency preparedness and response, but also assisting the town when they need additional resources. It could be a number of different activation opportunities, but we are looking to enhance our memberships in any one of these collaborations. I'm going to turn it over to Lisa, and we're going to talk about some of the evidence-based programming that we offer. We offer these with funding from the federal government, so we really hope that we're going to be able to continue to sustain these really important programs, because we have heard, and you'll hear from Lisa as one of our educators and our community health workers, that these are just vital, vital programs. So without further ado, I'm going to turn it over to Lisa, and she'll walk you through it.
She'll be back.
I'll be back. I'm not going anywhere.
She'll be back. All right, let me get my mic on. I don't want to be the person holding you up from that UConn game, so I'm going to try to clip this on and get moving along quickly. Okay, so as just mentioned, I'm going to talk a little bit about the other types of programs that the health department offers. Again, we do all of those environmental tasks, the restaurant inspections and things like that. But we have a community health division, of which I am a part, and we do these evidence-based programs. So falls. We all hear a lot about falls as we're aging. It's a major concern. It's something that we really start to think about, especially if we've fallen or know someone who's fallen. It's really something that starts to get in your head, right, as you're aging. That's little data. I don't know if you're going to be able to see it, but this over here on the left-hand side is talking about fatal falls and the way those numbers are changing. And then these are actually, this is some local data that, again, you'll find in our community health needs assessment that shows rates per 10,000, the Valley is a little bit lower than the rates overall in the state of Connecticut. However, if you look by town, you can see that some of the towns have higher rates and higher instances of falls than others. So one of the things we do, or we offer, a program we offer is called A Matter of Balance. I don't know if anyone has ever taken a Matter of Balance program before. It's an 8-week evidence-based program where we focus on fear of falling, talking those kinds of things through. There's an exercise component to it where we do some flexibility and just balance exercises that really helps folks to move around a little bit. It's not strenuous, we're not running laps or anything like that, but we're definitely focusing on the things that are important to keep us mobile and keep us standing and maintaining that balance, that sense of balance. I don't know that we've run one here, Mary, but we might want to think about doing that sometime in the near future. It's really popular. People really do love it. We find that people come back through it. You know, after a couple of years, if they haven't done it, they'll come back through it and do it again. So it's really been a very successful program in terms of helping folks deal with their fear of falling and then give them some physical assistance to help them to maintain that balance. This is just a little bit of a graph that shows we do like a pre and post when we do the Matter of Balance program, and this shows that people are improving. These scores show improvement on how sure are you that you can get up from a fall. That's the pre, that's the last. You can see that the scores are all going up. So the program really does work, and it's been a big benefit to the folks in the community. All right, let's talk a little bit about chronic conditions. Again, this is data that comes from that community health needs assessment. You can see that rates per 10,000 over here, the #1 challenge or chronic condition in the Valley is heart disease. It's something that folks struggle with, certainly, and then mental illness. Now, these rates are hospital encounters. So we're looking at why are people going to ERs? Why are people going to the hospital? And that's what those numbers indicate there. This chart down here just shows by town a bunch of different conditions: asthma, COPD, COVID, diabetes, heart disease, et cetera, what those numbers look like. And again, that heart disease number really jumps out at us. And in this case, the Valley is actually running ahead of the state of Connecticut with visits to the ERs for heart disease. So for chronic conditions, what we do is we have these programs called, is that? No. We're missing a slide. Anyway, we have these programs that are called chronic disease self-management programs. Back in April, we did a diabetes self-management program here. I don't know if anybody in the room attended. I don't recognize any of you, so maybe not. But there's 3 different programs that we offer. Chronic disease self-management, which is kind of an overall catch-all if you're managing any kind of a chronic disease. Then there's a specific diabetes self-management, which focuses on the things more relative to diabetes, managing a diabetes. And then chronic pain self-management, which talks a lot about how to manage chronic pain and how to work through it. And the purpose of these programs is to help people become better self-managers, advocate for themselves. It talks all about dealing with your healthcare professional, how to think about nutrition, how to think about physical activity, not just as exercise, but all of the work you do and the walking you do and the housework, God bless you, and the housework you do and all of that, that's all physical activity. So we kind of reframe thought around how we're maintaining and how healthy we are. And a big component of these programs is the idea that we're getting people in a room who are struggling with similar things. And there's such community in that. These programs are 6 weeks long. At the end of the 6 weeks, people want to do it again because we've come together, you know, the 10 of us or 12 of us or however many of us there are in that room, and really talked these things through and supported each other. It's an evidence-based program, so the 2 leaders are up there and we're reading out of a manual and we're going through all of the information in the program. But one of the biggest benefits of these programs is what's shared in that room. I had that happen to me once, and this is what I did, and the sharing of ideas, it's really just a wonderful experience. So if you see one of these programs in the community, I would strongly recommend taking it. What did you like about this program? There was practical information. The speakers all have knowledgeable information. I liked everything. The book is really great. Class discussions, again, I liked everything. A very informative and relaxing atmosphere. These are just some testimonials from the folks who've come through the program. So again, if you see those programs, I would strongly recommend giving it a look. And then there's the mental and behavioral health aspect of it. When we talk about the health of a person, we're talking about whole health. Not just that physical health, not just the ability to avoid falls, not just managing those chronic conditions, but managing your mental and behavioral health. Isolation is a leading cause of depression for seniors. During COVID, there was a lot of that started, right? We all stayed home, we all became isolated. If we were tech savvy enough, we were able to stay connected because we could FaceTime, or we were on Zoom, or we were doing all those things. But that wasn't available to everybody. So we started to isolate a little bit more during that time. So for residents 65 and older, over the past 6 months, there were 465 hospital encounters with a mental health component. That's over 6 months. That's a lot, where mental health was part of, maybe not the only thing driving the person to the hospital, but was part of it and was part of that diagnosis. There were 62 hospital encounters for alcohol-related issues, so to the point where a person had to go to the ER. And then there were 19 hospital encounters for suspected opioid overdoses for people over the age of 65 in the past 6 months. So, those numbers are definitely something to consider. A key takeaway here from the National Council on Aging: social isolation and loneliness, despite being different, are connected and can deeply impact the quality of life for older adults. Physical, emotional, and mental health of older adults are directly impacted by social connection. We have to stay connected. All of the speakers tonight mentioned staying connected and staying in a social situation. Really important. There are proactive steps older adults can take to reduce the harmful effects relating to isolation and loneliness. Come to the senior center. Go to these programs that are out there. Take these classes that are out there. Join together for lunch. Go to Griffin Hospital to that communal lunch that's happening. Take advantage of all of these things that are in the community, because isolation is the worst possible thing that you can do for your health, for your overall health. The good news is, there is good news, right? There's always got to be good news. So the good news is that in the surveying that Jess was mentioning before, if you look at the mental well-being and support of Valley community members, how often do you get the social and emotional support you need? 48% of folks age 65 and older said always. And then another 31% said usually, and another 13% said sometimes. So while those numbers are higher than they are in the other age categories, it doesn't mean that folks that are in this age category aren't feeling that depression and that loneliness, right? Same thing, over the past 2 weeks, how often have you felt down, depressed, or hopeless? The numbers are lower when it comes over here. Now, it is also harder for people in that age category to admit that they're feeling that way, right? So we might not be getting all of the information when we're looking at this. There's a lot of stigma around mental health. It's long-standing, and we know that as we've grown up and gone through generational issues, that we might not be getting the facts here as we're looking at that. So a couple of programs that we offer here. We offer something called QPR, Question, Persuade, Refer. And this is an evidence-based suicide prevention program. It's about an hour long. We can do it virtually or in person. We can do it so that it is tailored to seniors and their caregivers. We did Teams outreach group. We've done Area Agency on Aging. We've gone through a couple of area agencies on aging and done their care teams and the folks that are dealing with seniors. And we've had a lot of seniors come through the program, because one thing that we don't recognize, we think about suicide, we think about young people and how tragic that is, and it's very tragic. But the biggest growing demographic right now of people completing suicide are men 75 and older. It is growing. So it's really something to pay attention to. So if you see a program like this that's being offered, in fact, I have a flyer back there. We're offering one on January 26th virtually. Sign up and join in. It just gives you practical ways to recognize when someone might be struggling with a mental health issue. You're not going to come out with a psych degree, believe me. If it was that easy, I'd be all over it. But you will come out with a better understanding of recognizing when someone's suffering and how they might be suffering. And then this longer term program, Mental Health First Aid, that's about 6 hours, so it takes a little bit longer. It goes into mental health conditions a little bit more in depth. We can do that virtually or in person as well. Both are really great options. If you're interested in learning a little bit more, you can definitely reach out to me. Back to you. Back to you, Jess. Now you have to get everybody home to their...
I feel like a news correspondent. All right. Let me get this mic situated again.
While Jess is getting ready here, don't forget to write down your questions. I will be coming around and picking them up soon.
Just have to hold this one. Okay, so we're almost done, don't worry. But along the topic of mental and behavioral health and thinking about how big those terms are and those umbrella terms, I just want to highlight a little bit about our Naugatuck Valley Overdose Prevention and Education Program, or what we call the NOPE program for short. So this is something that we've been working on for the last 11 years or so here in the Valley, and it's not a new concept. I'm sure you've heard about the opioid crisis that is going on all across the country, not just here in Connecticut, but it continues to affect our population. And as Lisa said, when we look at hospital utilization, premature deaths, or individuals who are passing away from intoxication, oftentimes it's not just one substance. Usually it's a concoction of different substances or pills, alcohol. It could be opioids mixed with other types of medication like benzos or others. But it doesn't have to just be street drug use, which I think there is a perception among the community. It could be mismanaging prescribed medication, and we do see that. It could be accessing prescribed medication from someone else, and you may not even know that it's happening. So when we're thinking about keeping our houses tidy and spring cleaning, or inviting family members into our homes for the holidays, or people that don't usually hang around, we want to make sure that things are kept secure and not accessible to those who shouldn't be accessing them. So if you have medication that has expired, it's unused, you don't need it anymore, first of all, always take your medication as prescribed. But if you do have stuff in your medicine cabinets or in your homes, we do have safe ways that you can dispose of it with no questions asked in multiple different ways. You can go to the Ansonia, the Shelton, or the Naugatuck Police Department lobbies, which are open 24/7. And you can look for this box here, which kind of looks like a mailbox. It's secure to the ground, you open it up, you drop your stuff in, no one can access it except for an officer that's paired up with another officer to safely dispose of it. There is a CVS in Ansonia that also has a medication drop box. But if you can't make it out, maybe transportation's hard, maybe you just don't feel comfortable going to one of those locations, we do have with us tonight what we call doTERRA medication bags. So in these bags, this particular one can hold 90 pills, 12 ounces of liquid medication, or 12 patches. You just rip off the top, dump your pills in, and inside, if you touch it and feel it, you might be able to hear it, there's a carbon pouch in there. And when you add faucet water from your sink, just regular water, seal it back up, it's gonna deactivate that medication and make it safe to throw away at home. So you don't have to worry about an animal getting into your garbage, or someone picking through your garbage and getting access to your pills, or when it goes ultimately to the landfill, it contaminating the environment. This is a good type of way to dispose of medication at home, especially if we're cleaning out a family member's home, or like I said, just doing some spring cleaning or winter cleaning. We provide free Narcan to the community. Narcan is an opioid reversal agent, so if someone is experiencing an opioid-related overdose, this tool here can help reverse that overdose and save a life. If anybody is interested in learning how to use Narcan or would like to keep Narcan at home, you can certainly reach out to your senior center colleagues, to the health department directly, to the libraries. We are making sure that we are offering this program in as many places as we can with community partners like EH Cares, Alliance for Prevention and Wellness, Cornell Scott Hill Health Center, the health department, and others. So it's an appropriate training for anybody that's 18 and older. I really want to emphasize that you have the ability to say no to an opioid prescription. Not a lot of people realize that. When your doctor prescribes you an opioid, you may think, gee, I need this. But if you don't want that opioid, Connecticut has a law that you can put that non-opioid directive on your medical file, so no matter what doctor you go to or what pharmacy you go to, they won't hound you about it. They won't try to force it to you. So that is your right, anybody's right in the state of Connecticut. All right, wrapping it up now. Resources. You heard a lot about the Community Index data resource, right? We have something that we're calling the Naugatuck Valley Resource Directory. That was a product that came out of our last community health improvement plan. This includes things like primary care, dental, eye care, specialty care, substance use, behavioral health services, long COVID treatment, women's health, food banks, resources that provide you what insurance they accept, what hours they take patients, if they are taking new patients, if they're booked out 6 months. I don't want to waste my time calling. I want to know where I can get the resources I need. So we're trying to make that information accessible to you all. And that's a partnership through the Valley Council for Health and Human Services. And we're collaborating also to create a better referral system and hub so that if you are at a doctor's appointment and you do say, gee, I really want to participate in this chronic disease program I heard about, but I don't remember how to sign up for it. We all have that kind of community connection there. 211. All right, this little graphic here. When it's helpful, so health and human services. E, energy and heat needs. L, loss of income or insurance. P, primary or health care. Those are things that are appropriate to call 211 for. 911, emergencies. This is vital. V, for violence to self or others. I, illegal activity. T, threat. A, ambulance, fire, or police. L, lives are at risk. 211, 911, both very important to know the difference, but also that they're accessible. You heard about these other resources through the state agency, the Agency on Aging. There's several others out there. But really, if you have any questions, the biggest thing is don't be afraid to ask, because chances are you're not the first person or only person to ask, and chances are one of us can connect you with that resource you're looking for. So thank you all. Now I will take a break from talking. We'll turn back to Stacey.
Okay, thank you, everybody. So we're going to go on to the questions now, and we have a few. I'm going to try to read them, and our panelists, I'll try to figure out who the question should be directed to. So the first one is, if the state recognizes the overlapping needs of the disabled and aging populations, what prevents our senior centers from doing the same? So everyone's looking at Mary. That might be a Mary question.
Can you read that question again?
So the question is, if the state recognizes the overlapping needs of the disabled and aging populations, what prevents our senior centers from doing the same?
So, go ahead.
I think this question might be based on age.
Yeah, so is the question, I'm thinking the question is, are we serving both populations? Okay. I need a microphone. It sounds like the question may be, our seniors, am I correct to say the question is, are we serving both populations in our senior centers? Is that the real question?
I believe that is the question. The person is no longer here.
Okay, so I can tell you that our senior center serves both. I'm not sure what is preventing others from doing it. We serve both. I guess I'd have to look into this and get some more information. I really don't know. I have to be honest. We serve both here. That's what we do.
So this is a community center, like Mary had said. So it's 55 and
well, it's 50 plus. We're a community center. So we do, you guys are going to walk out, there's going to be basketball going on. So we serve both, right? Our age is 50 plus, but we have individuals with disabilities that come to us, and they will be a part of our 50 plus program, and they may not be 50. Most of them are, and they're perfectly fine to come in. So we would never turn anyone away like that.
There are some senior centers in the valley that are age restricted due to grants that they were built on.
Right.
So that may be a little bit different, and that may be what this question is reflecting.
So I guess maybe another thing now that I'm thinking about it too, exactly, our programs are geared to 50 plus, right? So if we have individuals that are 20 and 25, it does present some problems with the funding that we're receiving. I was thinking of it as individuals with disabilities that met the age, so.
So I'm going to move on. Thank you, Mary.
Okay.
We will
I can
keep
pass
this
it on.
one.
I'll
Yes,
pass it on.
exactly. Okay, so the next one has a few questions on it. Workshops open to friends and families to learn with seniors. So our senior center is open for friends and families to come.
So, I think I'm still on. We have offered and tried to offer some intergenerational programs, and we're continuing to try. So yes, we're absolutely open to that. I will say the couple of times we've tried it, it went really well for a couple of months, and then our numbers went way down. So as you can imagine, you know, we look at programs that are going to work, but we always go back to them. So yeah, it's a great idea, and we do look at intergenerational programs.
Okay.
Yeah, so I would just say, sorry, for the chronic disease self-management program that we talked about, thank you, I'll stop shouting. For the chronic disease self-management program that we talked about and the falls prevention, we do invite caregivers to come so that not only is the person learning how to be a good self-manager, but those around them are also taking advantage of it, so we do encourage that as well.
Yeah, and I'll say like diabetes self-management too, pre-diabetics as well. With our community health improvement plan, we're hoping to do more education around food and nutrition. That will be the whole community from children on up to seniors. So really looking at the entire population. So again, some of it comes down to funding restrictions or the evidence-based program, who owns the program and who it can be delivered to. And some of it comes for age appropriateness, but some of the programs also, like our suicide prevention program, we can tailor it to specific audiences. It can be tailored towards a certain target population. So I think in general, we try to be as inclusive as possible. Sometimes you may see it advertised one way, but again, reach out and ask, because even if it's not something that's currently being offered, if we can develop or adopt something, we'd love to know that there's a need or a desire to do that. So I think that's a great question and important.
Okay, hold on to the microphone.
Okay.
So the next question is insurance necessary for in-home vaccines by a nurse?
So when we provide our homebound immunizations, typically we do some pre-screening appointment scheduling. So we will make sure that if
the service we are providing requires insurance, that's dealt with ahead of time, and that any identification that may be needed or approvals or authorizations from a primary care physician, that's already taken care of before that point of interaction. If there is a person who is uninsured or does not have an insurance that we accept or can bill for at the health department, we have great partnerships with several pharmacies and healthcare providers around the valley that we will make that referral to and make that coordinated site visit for that homebound individual. So if we can't provide it due to a barrier dealing with insurance, we'll make sure that someone that can does get out there and you'll get that service that you need.
Thank you, breaking through those barriers. Okay, another question. How do we get people on a Matter of Balance program?
All right, so I'm going to turn this one to Lisa, but I think it's important for us to know, and maybe this is some of the feedback that if you attend the community center and can talk to Mary or Morgan or one of the staff members here, we want to know how you're getting your information. So we send it out through as many channels as we can when we're advertising, and whether it's, online, whether it's posting billboards on community locations or at a coffee shop or something. We're trying to get creative, but we really sometimes rely on word of mouth as well. And we know that not everybody uses technology, so the more that we can do, right now we have a few commercial ads running and radio ads running for some of our programs. Those can be quite costly, so if you have ideas or you're not hearing about our programs, definitely let us know. But Lisa, if you have anything to add.
Yeah, I would just say that if you're interested in seeing a Matter of Balance happen in your local community center, you can look in that direction, and we can certainly talk about getting one scheduled. Sometimes we do these programs often in the senior centers in the community, and sometimes, depending on the senior center, they may have a requirement that you're a member in order to take the program. Not all do, but some do. I don't know what yours, you do. Yeah, but if you want to see a Matter of Balance get kicked off here, you talk to that nice lady and we'll get it all figured out for you.
Okay, thank you. Getting close to time. In Connecticut, support for in-home care versus nursing homes, assisted living facilities. I'm not quite sure what the question is out of this.
What's the difference?
I think it really depends on the individual and what the individual needs are. So when planning for life care, at no matter what point it is, you're going to need assessments with your care team. So that could be your support network, your family, what's available to you, your physicians, whether you need specialty care or are dependent on medical assisted devices and things like that. So I think cost also, preference, desire to do certain things. Some people know exactly the path they want to take and some want to explore, and I think either way is okay as long as it's being thought out. So I think at the end of the day, it's really a unique pathway that everybody needs to look at, but with your support team, and that's inclusive of your community, your family, but also your caregivers and their recommendations.
Okay, so the next question is, can someone help with chores, med management, light housekeeping, resources for that? I think that goes to David.
Yeah, and I think I'm still.
He's just going to shout.
I think I'm still wired.
I think he's still attached.
And also on the home care,
David, that's not part of the system.
Yeah, it's going to that.
Yeah, so in going back to the home care one as well, what I would recommend, absolutely, we would love that. And so if we can either, at the pleasure of the Valley Community Foundation, give our contact information if you want to talk more about it and dive deeper on the home care question, which is a really good question, and that question as well. Or we're here if you want to come approach us afterwards. We could talk about the volunteer caregiver or the homemaking need that is what that sounds like, which may very likely connect with what we can do at Team. But also that home care question, that's a really good question, and the answer is never 1 + 1 = 2. It's very complicated, and that's part of what we do on the elderly care management work that we do with our dedicated staff. Stephanie, Jillian, MJ, and myself will still be here.
And that's part of that pre-planning.
That's right, what Jess was touching on. Yeah, absolutely.
Exactly. Okay. Do you get help out the door for doctor appointments? Rollator places, well water at home, so different services it looks like, and it looks like a distinction between the health services and medical services. And is that with Team, I think maybe they're asking if you get help out the door for doctor appointments? I think a lot of the senior centers with their transportation, and Mary would be able to talk to this too, the drivers are not allowed to go into the home.
Right.
So they have to be able to come out to the bus, ambulate on the bus, and then get into the appointment. So I think the question is, are there people who can be almost like a companion to?
Yeah, I just want to add that that's part of the home assessment. So if you're...
I'm going to give the mic.
Give that amazing leader a microphone. Jillian Ruisi, Team A.
I just wanted to say that that's part of the home assessment. So if you're needing more care at home, you're needing more homemaking hours, you're needing hands-on care, that's somebody to come out and do an assessment so that we can make that referral to the Agency on Aging so that they can help you to those doctor's appointments. So yeah, that's something that you could call Team for and we'll help out.
Thank you, Jillian. One of the things I wanted to say before I forget is these slides are available. So a lot of people, when they signed up, we didn't get their email. So take one of those little index cards, write your name, your email, and if you want those slides, we can certainly get them to you. There's a basket way at the back on the resource table, and just toss them in there and we can get you the slides, okay? Okay, that was all the questions, I think. Does anyone else have anything? No?
I have a question.
Okay.
I have a friend, she has some health problems, and I don't know, she's 70 years old. I'm wondering if she could get extra, like, meals or something like that, but I never asked her if it seems like she's having some.
Okay, so that's something too for Team, and that
Yeah, we may be able to help with that. And we can put it on what Sandy was describing, but also info@teaminc.org. We can send this out after. If you want to send an email or connect with us afterwards, we're happy to, we're here. Yep,
Okay.
It's a great question.
Again, those connections to resources are so important. Jess, did you have something else to say?
I just want to, just a quick plug. So in the back, there's all those great resources on the table that you probably saw when you walked into the room. If you didn't see the table on the side where the door is, those medication disposal pouches are there, so please feel free to take one. We also have these magnets that can go onto your refrigerator, and inside you can write things like medication you're on, emergency contacts, and that way, if there is an emergency and someone needs to enter your home, they can visibly see this right on your fridge and grab all the important information they need. And finally, just a plug, it is respiratory viral season. We have the holidays coming up. There are plenty of COVID test kits in the back. These are the at-home test kits. Take some, please do. And if there aren't any back there or you need more, call our office. We have free resources available to you. We can arrange for delivery if you can't make it to our office. But we thank you all for spending your evening with us. Sandy?
So just a few other things, I'm sorry, and then I'll let everybody go. So next year, the senior fair, if any of you attended the senior fair in Ansonia this year, 2025, they have the date for the 2026. It's going to be October 7th at Warsaw Park in Ansonia, 10 to 2, and they're going to have over 50 vendors, over 50 vendors there. So if you can, try to put that on your calendar and make it out there, because that's, again, the connection to the resources, okay? One other thing, if there's any other topics that anyone wants to hear about for future community conversations, please feel free also to write that on an index. This is probably the first of many conversations that need to be had. And I'm just going to finish up the slides here. So opportunities in your community, be a voice, raise your voice, advocate for services in your town, write letters, attend meetings, all these things can help. And what we can do to pre-plan. One of the important things is, everyone talked about, is pre-planning. So an elder estate attorney, a financial advisor, those things are very important way in the future to start the conversations about for safe aging in your home. Assess your home. Is it aging friendly? Look to the future. Am I on one level? Do I have the ability to have my bedroom on the first floor? All those things are very important. And don't wait for an emergency. I think Jess said this. Pre-planning is key to comfortable and safe aging in place. When it's an emergency, sometimes bad decisions are made. So make sure you look to the future and your environment and your resources. And again, thank you to all the panelists, our esteemed panelists, and thank you all for coming tonight.